Strep throat infections are up both in our area and across the country. Jody Goldberg talked to doctors about what's behind the surge.
This is your everyday strep, and we are seeing tons and tons and tons of it.
Dr. Carrie Fierstein with Allied Physicians Group is seeing what she calls a noticeable uptick in the number of children coming in with strep throat.
It definitely feels a lot worse than it has been, but it is higher than even from before the pandemic, and we don't know why.
The Centers for Disease Control and Prevention is monitoring an increase in invasive group A strep infections in children after at least 5 pediatric deaths have been confirmed so far this year in Illinois. And in New York, a spokesperson for the State Department of Health says early indications show a slight increase in cases this calendar year as compared before the COVID-19 pandemic. This specific strain of strep, according to officials, is the result of the disease spreading to the blood muscles and lungs.
Treating strep is important because of the complications that can come down the road.
To prevent complications, Fierstein says it's important to make sure children have their basic vaccines, including chickenpox and flu.
People who are not vaccinated for those things, and if they get those infections, they are more likely to have an invasive strep infection like the kind that can be deadly.
And it's not just strep. Last week in the Babylon School District, more than 100 students were out with suspected norovirus. Tips, according to doctors, to stay healthy: washing your hands, coughing and sneezing into your elbow, and staying home if you're not feeling well.
Everything's going around: throwing up, sore throats, everything running the gamut. And a lot of kids have just been on constant antibiotics for weeks now because of it.
While antibiotics are recommended, doctors say it's important to confirm a positive case before starting.
But just because your child's throat is red or has pus in it does not mean it's strep.
Cases of strep throat, according to Fierstein, are most common between December and April. Jody Goldberg, Fox 5 News.